everybody. One second. What were we waiting? Just getting the. How are you? Thank you for hustling. Yeah. Did you break speeding laws and traffic laws? That's smart at the sheriff's.
Will you handle these, Dr. Smith, when it's
Yes.
turn to speak?
Yes. It's a fancy.
I got that for you. It's extra long.
Thank you. I appreciate that. That's nice. All right. Thank you. Dave, if you're willing to join us, that'd be great. And thank you. Thanks for being here. Appreciate it. You doing? Yeah, I'm sorry.
It's hard to stop that.
Old habits die hard. Exactly.
Dave, do you want to stand here? Sure.
All right. Well, good afternoon, everyone. Thank you. I feel like I just saw you all a few days ago because I did. But really appreciate you making time and very much appreciate the work you're doing to keep the public informed. I know there's a lot of anxiety and uncertainty, and again, our goal here is to just continue to communicate everything we know as we know it, and really be fact and data driven in the decisions we're making and how we're communicating, to minimize kind of overreaction, but make sure we're taking this seriously, which we very much are. So myself and Health Commissioner Dr. Carol Smith are going to start with just some initial statements and then mostly take your questions. And so we'll dive in. The main update we have here in Ulster County is that we did today confirm our second COVID-19 case in the county. And in response to that positive COVID case, Ulster County is taking additional precautions to ensure public health and safety, continuing to operate out of an abundance of caution. Two main updates. First, Dr. Smith is issuing additional guidance, which she'll talk more about, really designed to protect our most vulnerable residents. We now know more about how different individuals are affected by COVID-19, and so we're going to introduce additional precautions and guidance for more vulnerable folks. And second, in this second case, there was potential, although not confirmed, contact between the affected individual and members of the Wallkill School District community. And so because of that, and in very close coordination with the superintendent there, we made a recommendation, which they are following through on, to close the school district for the next 2 days and through the weekend, so Thursday and Friday, for cleaning and disinfecting, of the facilities. At the top line, we are right across the hall from here. We have had and continue to have our Emergency Operations Center up and running. We are closely monitoring all the developments on the ground, having kind of reports and information coming in, and we'll keep making decisions based on data as the situation develops and unfolds. And I remain and very much am fully confident in our response, not just as a county government, but honestly, I've been very impressed just with us as a community, how people are coming together, how we've actually had volunteers from Ulster Corps volunteer to man our hotline that we've stood up to help serve their community members who have questions. We've had people really looking out for each other, and we all know this, but it's just nice to see in a moment of kind of challenge to see the community rallying. So I'm really proud of that, and I thank our residents for their patience and really resilience in the face of the developments going on. So now I'll turn it over to Dr. Smith, and as I will say probably multiple times through Q&A, I always defer to our public health expert, who I have 100% trust and confidence in and appreciate. I mean, I don't know if you slept yet, Dr. Smith, but her and her team have been incredible, so thank you, and I'll hand it over to you.
Thank you, and I certainly want to share the appreciation for the county executive. He has given us his full support, and his leadership has really made quite a difference for us in being able to coordinate and respond to this situation in the way that we have over the last few weeks. We do prepare for the advent of something like this, we meaning the officials in public health. We have a preparedness coordinator that works with us every day. We work very closely with our emergency management department with Steve Peterson and his team. So we're very much aware of what we need to do to bring together the county resources at a time when they're needed in a situation like this. But I thank you, County Executive, for what you've done for us here. So we've been working on this particular incident now for a couple of weeks, and we don't want anyone to panic. This is not the time for panic. It's not productive. I think we all just need to take a deep breath and to remind ourselves that there are some common sense measures that we all can take. It is in our power to help prevent the spread of any kind of virus, this one or seasonal flu, which actually does kill far more than this one has so far. But in any event, so we continue to exercise the basic prevention measures, and based on some new developments in the county, i.e. our second positive case, we've amped up our recommendations. And as the county executive said, we are basing these recommendations in a timely fashion, appropriate to the situation at hand. So as a result of this second positive, we've been working very closely with the Wallkill superintendent and his administration, New York State Department of Health, the New York State Department of Education, in order to make sure that we're all giving the best guidance for this particular school system. We did recommend that the school close for the next 48 hours or so. Actually, that is even exceeding the state's recommendation of 24 hours, but we think we are doing the right thing here so that they can totally deep clean and disinfect their facility. They have the appropriate detergents on board in order to address the COVID virus and EPA certified disinfectants, et cetera. So we're doing everything that all of our colleagues in the world of disease control are recommending. We do want to also reiterate, which is a message that has gone out from all sources, the government in terms of Governor Cuomo, the CDC, the State Department of Health, that this virus seems to affect most severely our elderly populations, folks with chronic medical conditions. So we're asking those folks just to take good care of themselves and avoid participating in large congregate setting events, that sort of thing, so that we can be proactive about preventing the further spread of the disease. We will have a number available, and Dan can actually confirm that number. That the public can call if they have questions. Certainly, as we do in any situation, if somebody has symptoms of fever or worsening cough or shortness of breath, or they have underlying medical conditions that make them perhaps more prone to the more severe aspects of the condition or disease, that they contact their healthcare provider, as they would in any situation where they're not feeling well. We do have the capability to do some limited testing for those that we feel are most at risk of actually having COVID-19. Those test kits are still at a premium, and not necessarily any fault of ours, but this is something I think that's been a reflection of the cutbacks in the CDC and on the federal level. But we have managed to secure a very limited number of tests. reserved for people that very much have a high index of, or we have a high index of suspicion for COVID-19. So we're not advocating that everybody gets the test, or if you have, some very mild basic symptoms that could be a cold or sinus condition or allergies at this time of year, you need to discuss that with your healthcare provider. But for those who are most at risk, we do have that capability. You can contact the health department, or your provider can, to discuss what are the pros and cons of using that test for that particular situation. We do have updates on our county website. We have updates on our county health department website as well. We will be putting out messages as needed to answer people's questions, perhaps an FAQ type situation, and we're ready to respond to people's concerns. But again, we are acting with an abundance of caution. We're being very prudent and advocating for the best kind of interactions that we can in order to mitigate the further spread of this disease.
Can you mention assistant emergency?
Sure. In addition to working with the school, we're also advocating or recommending that our assisted or nursing home facilities really take the extra step of limiting visitors to their facilities so as not to make the residents sick. This should be done as a common sense measure, in my professional opinion, during flu season as well. We do see outbreaks, not necessarily in Ulster County, but across the state, of residents in these facilities who do wind up coming down with the flu because a visitor or someone else may have introduced it into their setting. So in any event, in this particular case, we think that that is the best practice, and we're recommending that they do not entertain visitors during this time, or at least until about the end of March, when we can get a better sense of how this situation will be evolving.
Thanks, Dr. Schmidt.
Sure.
So again, we're happy to take questions. I do want to also thank Legislature Chairman Dave Donaldson for being here, and all of our kind of partners across county government. My comments earlier about working together also, of course, extend to all of our colleagues. This is, to me, the perfect example of, frankly, why government matters in moments of challenge like this, to be able to serve our residents and keep everybody safe. And we've all been working together tightly on this, and really appreciate your leadership and support as well. So we'll open it up to questions and go from there.
John Barry at the Poughkeepsie Journal.
Hey, John.
Hi. 3 bullet points. The person, the second case, what town or village do
Yes.
they live in? What are the circumstances that the county became aware of this? And looking back to your press conference on Sunday, any indication they've had contact with people in Dutchess?
Right. So we're trying to follow the same protocols in terms of sharing information but protecting privacy. This individual is a senior, resides in the town of Shangam. When we have, again, been working closely with municipal leaders there. There are other family members who did live with that individual. We currently have a public health nurse on site there working through the tracing with them. At this point, to our knowledge, others in that family have not presented symptoms that would cause us to believe they have it, but we'll work that through in the community tracing process. What was your other? Oh, in terms of connectivity, so I will say just the proximity of those individuals to Orange County. I was on the phone just a few hours ago with County Executive Newhouse, coordinating on this. At this time, we do know that the individual traveled to Crystal Run Healthcare to get the actual test. So, our arbitrary county borders are not honored by these sorts of things, and so we have been coordinating closely both with state leaders and of course our surrounding counties.
So was it a case of them having symptoms and they went to Crystal Run and they did this on their own?
Yes, again, an individual, doing the right things, reaching out to a healthcare expert, getting that advice to go be tested. We do not yet know, there is no pattern of international travel for this individual. We're trying to ascertain whether there was regional travel or other points of exposure. We just don't have that information yet. As we get it, we'll be sure to share that with you all and with the public for obvious reasons.
And forgive me, but where exactly did they go for the test and where are they now? What are they doing now?
So the same protocol as in our first case. They went to Crystal Run in one of their facilities. I believe it was the Middletown site. Is that right? And then we're directed to return home pending test results. Has maintained at-home quarantine since then, and then was given the positive results.
And then what's their outlook? Is it a 14-day thing or,
Yeah, so it's the same protocol. Individuals are only across the country being admitted to hospitals if they're at that level of medical need, which again, we're fortunate in our second case, at least so far, neither of our cases have been in that sort of situation and needing that level of care. So that's the protocol right now.
So they're home.
Situation home, correct.
and how long do they have to quarantine?
I believe it's 14 days, correct, Dr. Smith? Yes, 14
And that's
days.
14 days from when?
It'll be 14 days from date of test.
And
Yeah.
when was that?
We received the results today, this morning.
Okay. Do we have an age for the person?
I
You said a
don't,
Senior.
and if we did, we're trying to
Okay.
get that
They're a
right
senior
balance.
citizen.
Correct.
Okay.
Is it a male? I believe it's a male, yeah.
Are you giving any thought to large-scale events? I think the
Yes.
NBA, they're going
We're
to.
giving a lot of thought to large scale.
You have venues here, there's a big concert Friday night.
Yeah, and Dr. Smith, feel free to jump in. We've actually set up a framework to evaluate any event happening in the county where organizers of those events are able to contact us, provide some information about the event across a few different parameters, and then we're actually assessing the risk and making a recommendation. The health department and Dr. Smith are making a recommendation to the organizers of everything from the spaghetti dinner here to major events, St. Patrick's Day festivals, and so on and so forth. We're continuing to give recommendations based on the specific kind of dynamics of that event. And so we're sharing that with those organizers, and then they're making the ultimate decision at this point. We're trying to, again, not make broad generalizations that might be overreacting, but also empower those organizers with a true public health expert's recommendation.
So you're leaving it in the organizer's hands right now.
We're giving them guidance, and ultimately, that's their prerogative. I mean, for government events, obviously, that's us, but for other events, we wouldn't want to weigh in on that at this point.
But like UPAP Friday night or the St. Patrick's Day parade.
We have
maybe
other
Sunday.
questions too, so I'll make sure we have.
Sure,
time for
sure.
everyone. Yep.
Bill, I'm sorry.
Diane Panaros of
Hey, Diane.
Freeman.
I'm sorry I missed your call this morning. It's been a little crazy.
Imagine. As you know, March Gallagher has put up a stay-home Facebook event.
Somebody told me about
What's your
that.
reaction?
I mean, to be honest, I've just been focused on the Emergency Operations Center and thinking about the health and safety of 180,000 residents. I take expert medical advice from our Commissioner of Health, who's both a doctor and a public health expert, and that's how we're making all the decisions that we're making. So the guidance we've put out, we feel really good about, that it's that right balance of safety and health and not overreaction.
Should the county controller be coming out with recommendations of that nature?
Like I said, I always look to the public health experts. That's how, as a county executive, I'm making those decisions. Raven? Oh, I'm sorry, Bill,
Okay.
sorry.
Dr. Smith had said that this incident we've been working on this particular incident for a couple weeks. Are you referring to the second incident?
No.
The third?
We act at the county
I'm gonna
executives,
give you the, give you
thank
my
you.
first.
along with the county executive and his team, we made a decision actually before the first confirmed case, that as soon as we did get one confirmed case, that we would stand up the Emergency Operations Center, and that center has been under full steam since that case. We learned about this particular second case this morning, but we've been working literally around the clock at the EOC to try to ensure that we're developing a strong coordinated response, which we have in place, and that we have the way to share information as appropriate, to reassure the community. I think that we are in a good place with respect to that sort of preparation as best we can as a governmental agency, and we've been working very hard.
Given that the Wyndham-Ashland Jewett School District also closed today, that they announced,
Up in Greene County.
up in Greene County, how closely are you following what happens up there and the fact that skiers are still coming down and getting on the thruway down in Ulster County?
We do, as a public health community, both in the regional sense and in the statewide sense. The public health directors and commissioners are in constant contact. So we do inform each other about what is happening in our respective county. If we feel as though for instance, in Orange County sense, I was speaking with this morning as soon as I learned of this test result with the Commissioner of Health in Orange County, Dr. Irina Gilman. So we definitely connect with each other. We follow what's going on, especially in contiguous counties. We try to, as best we can, develop coordinated responses, especially if the case impacts them in any way, whether it's directly or tangentially. We think that that's the right basic standard of practice, and we do that for sure. So yes, we would follow Greene County, we would follow Orange, Dutchess, and we would be in
All right,
communication.
last question, because we do have to get back to the
Right,
cases.
no,
Yep.
yeah, we do too. Last question, so you recommended and they closed the Wallkill School District. Last night, Ontiora was talking about they've set up Google Classroom
Mhm.
and Google Sites. What can you tell us about the preparation of school districts in the county for any sort of extended closure and the maintaining of education?
Yeah. Whoops, see if I don't break that. I wouldn't want to speak directly for the school districts. I'll say every day we have a standing call with all the leadership of the school districts. I know they're all looking at, as are we in the government, as are I think many other entities, kind of work remote or teach remote type of plans. So I just wouldn't want to speak for them on that.
Have you talked to them though about this?
Yeah, absolutely.
And what have they told you?
So, and again, I just want to reiterate to your first question, Bill, when Dr. Smith said we've been working this for weeks, she means just the overall COVID-19 situation. And in our early planning exercises, we included school leadership, and this was one of the things that we discussed as we talked about and thought about sort of an escalation phased planning process. So I know they're all at varying states of preparing for that and frankly the capability to do that. And then we're also watching the I'm sure you all saw the SUNY and CUNY announcements in terms of their decision to do that for the remainder of the semester. I'll just say from our perspective, a key element of the conversation with our K through 12 schools has been that beyond providing education, those schools also provide meals to a significant chunk of young folks and students. They also provide a place for young people to be, for working parents. So the decision calculus, I know, is a little bit different there. Obviously, health and safety are always going to be the guiding principle, but that's one of the factors that we've been talking through and thinking through with them.
And you'll be able to help them out in any way?
So BOCES really actually has the lead on that, and we've been working closely with Dr. Corey. I mean, BOCES, as you probably know, runs the kind of tech back end for the districts, and so I know they specifically have been working on that and thinking about that. So absolutely, that's the plan.
Great. I just want to go to Raven for questions.
So you guys are, Wallkill School District is closing, is that because there are kids in the home where the gentleman is living? Is that why the school district is
So
closing?
there are 2 family members in that home that are part of that Wallkill School District community. One is an employee, one is a student. So that's why that decision was made. And as Dr. Smith alluded to, the guidance from New York State Department of Health is really once the community in which a school is situated has that confirmed case, then they recommend 24 hours. In this case, we're exceeding that guidance.
And is this person one of the people that you guys were monitoring?
No, so this is at this point, there's no connection between the first and second cases. If that's what you're asking?
No, but because I remember at the press conference on Sunday, you said that there were individuals that you were monitoring.
Right.
Outside of the first case. Is this person? one
No,
of
this
those
is a new
case?
new
New
case.
person.
We're tracking all those, in our EOC, and that's in addition to the sort of the caseload we had been tracking. The good news is on that front, the vast majority of folks that we had been monitoring and evaluating have worked through the 14-day quarantine, and we're talking about the positives, but the positive cases, but the vast preponderance, really in line with the national data, is not seeing presentation of symptoms or confirmation.
And there's no connection between the first case and the second case, correct?
Correct, no connection.
I just want to go to Jesse Smith. This is actually going to have to be our last question, just because we have to.
We can take a few more. I want to make sure we get.
Are we treating this as a case of community transmission?
We haven't made that assessment yet. I don't know if you want to speak more to that, Dr. Smith. Let me give you the microphone.
What we do, what our nurses do is when we meet the person who is infected or of concern, one of the questions is travel history. This person did not volunteer any information about travel history. I believe he did not travel outside the country. He does commute in and out of the county. I don't know what regularity, but we do know there's some of that. There are no other known cases in that area, so I think to say community transmission right now may not be the best way to say it, because he may have in fact been infected in New York City or one of the other counties, but he is the only one in our county, in that area of the county right now. So community transmission usually means from person to person in a given locality. And right now, he's the only one that we know of in that area of the county.
Pat, can you just tell me about the Emergency Operations Center? What happens there? Is it manned 24 hours? And what does it give you the capacity to do that you couldn't do if it wasn't open?
Yeah, so it's here in this building across the hall. At this time, we're manning it 12 hours. We're not yet escalated to 24 hours, although we're prepared to do that if need be. I mean, the real value of the Emergency Operations Center is the collaboration that occurs within it. We've got leadership from all the key county departments and teams that are relevant, and we're able to, whether it's Dr. Smith and I, or Steve Peterson, or any of our, if we need to get a legal opinion on a particular case or situation, we're all physically in the same place. That lets us make decisions much more rapidly with a common situational picture, which is obviously critical. So that has been a huge plus for us to be able to respond more effectively and quickly. I'll let you guys can fight out who wants to go first.
No, I'm just wondering about the homeless community, or the community of people who do not have insurance, and if they have the symptoms, where would they go?
Yeah, exactly. And we know there are a lot of folks in our community in that situation. For those, the guidance that we've put out, which I think addresses this, is for those who don't have a regular provider, that would be your normal first step is call your provider if you have one. If you don't, we do have our county coronavirus hotline for anyone. I mean, we take all calls on that regardless of, and give that advice regardless of what's needed. And of course, if we recommend that that individual goes to a hospital, for example, they must be, per New York State law, thankfully treated and helped and taken care of. I do, and I meant to do this off the bat, and I apologize. In our press release right before this event, we shared a number for our hotline. which we realized actually doesn't have the capacity that we think we might need to take incoming calls. So I want to ask your mercy in giving a correction on that number. I can give it to you now. We'll also send it out via email. The correct number for the Ulster County COVID-19 hotline is 845-443-8888. 845-443-8888. And for anybody, I know we're streaming on Facebook Live. If you're in doubt, if you have questions or you're just uncertain, you can call that number. We also have provided the New York State hotline if for some reason, that's 24/7 if for some reason you're not getting a response from us. And I just want to really encourage, again, residents of our community, if you're not sure, reach out to us, reach out to your provider, and stay home until you get more guidance in order to protect your fellow residents. So.
Hi, sorry,
How are you?
Angelica Radio Kingston, that was from Maria Fiori. I just want to make sure, well, how are you going to get this information to the Spanish-speaking community residents, on your website and in the streets?
It's a great question. We can get a translated version available of our release. I'd ask your all's help in the meantime if you're willing. We'd be happy to, myself or someone, come on, Lavos or any other programming that would make sense to get this out. It's a great point, and we don't have the right answer this minute, but we will get that fixed.
So, like, what about the business owners, restaurants where people gather, and they need to know how to get all those preventive measures?
Right. We've had an extensive, public education and awareness campaign. That's part of the reason we're here, and appreciate your help spreading the word. One of the things we've thought about, but we may do in the near term, is a sort of a teletown hall type of thing direct with residents. We don't have that planned yet, but that's something that we've thought about, so people can directly ask questions of myself or Dr. Smith or others. We want to be as accessible as we can, and as information changes, make sure we're sharing it.
If people call this number, do they speak in Spanish and get somebody who's going to answer them in Spanish?
I don't know the answer to that. I'm confident we can stand that up. I don't know that we're there yet, and that's unacceptable, so we'll work on that.
And then the last question is, how many suspected cases you have?
So suspected cases is not really and jump in, Dr. Smith. What we really have two categories of folks. One are confirmed cases that have been tested and confirmed. The other are individuals who are being monitored for exposure either due to travel through a suspected area or to another affected individual. I think the latest.
It's termed precautionary quarantine.
Yeah.
And fortunately, the group that we have under precautionary quarantine monitoring has been asymptomatic. And as County Executive said, some of them now are off quarantine because they've had no symptoms for 14 days. So that has been working. That has been the guidance of the state to use that type of system. They're not suspected cases. They just have some risk factors for which we think it's most prudent to put them under precautionary
And one of our, just to expand on
monitoring.
that. I'm sorry, Dr. Smith. I think this is really important because there are a lot of people, we've already heard some reports of, other community members suspecting others or having this sort of paranoia or, irrational kind of behavior towards others, and using terms like suspected, we think would feed that.
Thank you.
Because we actually want to reward and thank people who are come forward and say, hey, I'm not sure, but maybe I was here or there, and let's just be safe to protect the community. So the last thing I want to do is, put them in some sort of category or label that would punish them for doing the right thing. We want people to feel safe and protected coming forward, saying I may have been in contact or may have traveled to a place, even if it's not on the list yet, that I just want to be safe and do the right thing. So
The one thing we've heard is that children can be asymptomatic but carriers, right? And
Correct.
so it really affects adults. So why would you choose to close the schools for only 5 days, not 14?
do you want to speak to that?
At this point, that is an assumption too. And, in order to understand a disease, you have to basically see how it plays out within a population. this is a novel virus. That's why it's spreading so quickly. There's no immunity to it in the human population. World Health Organization just deemed it a pandemic, meaning it is present in almost every country across the globe. So we don't know for sure. It seems that children are less likely to develop the more severe symptoms. And again, 80% of the cases from the data that's coming in now through World Health Organization and CDC is that 80% of those who are infected have mild to moderate symptoms. Only about 20% or so really fall into the category of severe symptoms, which can progress then to a fatal situation. But that's about 20% of the population overall. At least that's what the data is starting to look like as we look at this and how it's progressed over the last several weeks.
This weekend is in the city of Kingston is hosting the Shamrock Run and the St. Patrick's Parade. Has the county given the Hibernians in the city its guidance on this large gathering event?
Yeah, so we've had an ongoing conversation since Sunday, after our first case, myself and the mayor and our teams. We're continuing to have that discussion. We're both looking at what other localities are doing, from major cities to minor. And then again, using the data we have on the ground here. Tomorrow, myself and the mayor and our collective teams are going to sit down and I think kind of have a discussion in hopes that we can get some final clarity to folks. But even to your question, ma'am, about kind of the school timeline, what we don't want to, we want to kind of make decisions as the situation develops. So we always have the ability to extend that 4 days if, as we learn more from our community tracing and speaking with those folks, rather than just, potentially overreacting. We'll make decisions in real time. I know people like to plan ahead, and I understand that, but I think this is the prudent way to sort of operate. So we're getting that balance right. So I think we'll have probably more of a sense of that by tomorrow.
And you'll make an announcement?
Yes, and as someone who loves St. Patrick's Day, I'm monitoring this very closely. I was excited to run in the race this year, but we'll see kind of what everybody's thinking there.
Just to clarify, the person in Shongum, the elderly male, he's self-quarantined for 14 days, as are the 2 people in his household.
3 in the household, 3 additional.
Him and 3.
Correct.
We had an employee of the school district, a student in the school district, and then
One other
person.
family member.
And are they related to the school district at all?
Just the 2 that I
Just
mentioned.
the 2. So that's the level of response and treatment is for those folks to self-quarantine.
Correct.
And you mentioned that they commute out of Ulster County. Do we know where, and do we know anywhere else this person might have been, and is that being investigated?
It's definitely being investigated. That's the role of the public health nurses are almost like a mini CSI team in a way. They show up, engage, and ask all those questions to assess that travel and other contacts. The only information we know about other travel I mentioned, which was into Orange County for the test. As we learn, if and when we learn more, we will obviously share that. Again, I think everybody whether it's an event organizer or individual family trying to make decisions about their family and so on, we want people to have the most possible information to make the safest decisions.
I'm sorry, there wasn't mentioned that he commutes out of the county?
We don't have full information on that yet. The preliminary report was that it's possible.
We don't know where.
Yeah, I just don't want to confirm that kind of information
Okay.
until we definitely know it. I've been joking in many instances with folks, half joking. The number 1 rule we learned in our operations center as an Army officer was the first report is almost always wrong. So we're operating by that rule here. We really want to make sure we have everything right before we share that.
All right,
We'll
we have time for like one more.
Yep.
Just ask on the medical status. These are confirmed cases, not presumptive cases. In other words, both of these individuals have had the test, it's gone to the lab in Albany, and it's come back positive. Is that correct? Then on Sunday, you were saying it's a presumptive case.
Yeah, and I can speak to that, or if you... Yeah, so, whoops, I did break the microphone. Sorry, Cal. So that term presumptive positive is a sort of industry term that really means in normal protocol you'd want 2 tests to confirm something like that. The presumptive positive in both of these cases that we've announced means the New York State lab at Wadsworth has confirmed positive for COVID-19. One test. And at the federal level, the CDC is actually assessing whether they need to do a double test, given just the overall testing need across the country. Exactly.
So they actually.
I just want to. We'll go and then you two, and then I know everybody needs to move on.
Since Sunday, have you added more people to the monitoring, the list of people you're monitoring, aside from those from?
We've had a few come on and a few come off, actually. So it's been, and those are the folks who just traveled through an international area that may have been, it was a level 2 or level 3.
Do you have a total number for the number of people you're monitoring right now?
We do, but we're not sharing that. Again, we're just trying to share when we know that someone is actually positive, rather than kind of speculate or blow things out of proportion. These are individuals who, again, just happen to travel through a certain part of the world. Maybe they stopped over in an airport on a flight and have no symptoms, and so it's really premature to release those kind of numbers.
Dr. Smith, what the condition of the man with the positive case now?
Now I really
His home, how would you characterize his health, the condition of his health?
Our nurses went down this afternoon to his home. They'll be able to give me more information when they get back. We presume he is stable from what we've gotten over the phone with him. The first positive case that we had is doing very, very well, asymptomatic and no fever, no cough, and he's doing very well. The second one, we're still in the process of assessing that situation.
Do you know if there are any additional people?
I just want to get to Bill, and then we'll come back to you, and then we do need to go.
Have you developed the formula that tells you when the hospital is beginning to get slammed? And could you share what that formula would be?
Yeah, so we've been in, I think Dr. Smith was on with Dr. Doyle from Health Alliance just a few hours ago. We're in regular communication with them. That's one of our core sort of thresholds we're looking at. Right now, we're nowhere near that, which is good news. That is one of the sort of phases of the situation, and we've seen other places reach that capacity. So we're not there yet, and we feel good right now about our ability, and if that changes, we'll let people know.
But you do have a formula.
Formula might be generous.
What would you call it?
We're thinking about it in terms of thresholds. What's bed capacity? How long do people need to be in there? So I guess.
And you're monitoring on a daily basis?
Hourly, by minute. We're really in very tight communication with the hospitals, both Ellenville and the Health Alliance, Kingston and Margaretville.
Thank you.
Raven, get the last word.
The gentleman went to Crystal Run to get tested. Do you know of any people that were impacted, well, not impacted, but that tested positive at Crystal Run, if that's associated to this gentleman or when he was there? Do you know if they have?
At this point, we have no reason to believe that. Just like in Kingston, the hospitals have been ready and exercising this capability to deal with these patients. And we'll let them speak to that if needed, but at this point, that's part of the process that has been going very smoothly, and we anticipate will continue to. So,
There's a question about identity, because I understand the county wants to keep the identity of this person private, but the question is, wouldn't it help if the identity is revealed? Wouldn't it help to those who came in contact with this person so they can take measures or go and have a test or?
I think that's a very valid question. Right now, our belief is that that's less beneficial than the way we're doing, which gets that information without disclosing people's personal, both HIPAA and FERPA protected information. So I hear that, and I think that's probably a debate we can and should have as a country and frankly, a planet as we hopefully get out of the current situation. But I think this is the right way right now. It's also the method by which pretty much every government, I know in the country and in many other parts of the world, are operating. So appreciate the question, though. All right, and again, to the maybe 2 or 3 people that are watching at home, or however many it is, again, if you have questions or concerns, don't be afraid to reach out to us. I'll share the number one more time, 845-443-8888. We're here to answer your questions. I know this is a time of some uncertainty and anxiety, but just know that we're here to help work through that with you, and we appreciate your patience. So thanks, everybody. Appreciate it.
Thank you.